We're going to go over the proposed rules that are, potentially going to be on the horizon for everybody, whether you're a covered entity or a business associate. So first, decreasing response times for, giving individuals access to their PHI, going from 30 days to 15 days. I mean, that's a pretty significant cut, in our, but, business associate agreements would need to probably be amended in some cases. Just to make sure that you're not going to run into issues with the timeframes. Another thing would be prohibiting unreasonable identity verification requirements if you're trying to get access to your information. So another one, fee schedules. They want the covered entities to be posting it. They want patients to know what they have to pay and if they have to pay in order to get their information. And then they want to limit those fees, so that it's not unreasonable.
And that kind of goes in line with the Surprise Billing Act that was recently passed. Just the whole idea moving forward with all of these agencies is people need to know how much they're getting charged for things.
Yes.
And that now that HIPAA, these proposed rules in HIPAA have also included that provision of requiring fee schedules, it just kind of furthers that initiative that we've been seeing trending in the last few years. And, so to kind of go along with that, fees, what can we charge? There are 5 ways that a patient or someone can access their medical records. And, some is provided to the individual, some's provided to the personal representative. This chart kind of outlines it, but Jessica will go into a little more detail.
Yeah, I mean, I think the chart kind of speaks for itself. I wanted to make sure that you all had an example of exactly what HHS has in mind when it comes to allowable fees. Obviously the big thing is making sure that it's reasonable. So they're kind of limiting it with respect to, costs for labor, supplies, postage, and that sort of thing. But for the most part, I think this gives a lot more clarity to what to expect and really how these fees should be charged to patients or other individuals, such as third parties that might have some type of authorization from the patient to access the information.
Right, because in the past, a lot of covered entities, their policies would charge, X amount of cents per page, and it's a very arbitrary number, and it has worked in the past, but HHS is really, really focusing on this right to access initiative, and they do not want cost to be a barrier. So the tenet that you should always just remember when drafting these policies moving forward, even before these rules get published necessarily, is just reasonableness. What is reasonable here? And so another area of the HIPAA proposed rules is care coordination. So as a little bit of background, to give you some context here, the laws have recently been evolving with the Stark Law and the anti-kickback statute, and the healthcare industry as a whole has just been shifting more towards value-based care or care coordination. And care coordination usually just means that there is some sort of collaboration or coordination between a various amount of value-based entities. Sometimes they're in arrangements together, sometimes not. But either way, between these entities, PHI is being exchanged. And so, the meaning of healthcare operations when looking at this proposed rule includes uses and disclosures for care coordination and case management. So HIPAA is essentially trying to make it more possible and easy for these various entities to exchange PHI among each other. And so there's also a proposed exception to the minimum necessary requirement for uses and disclosures. So what the minimum necessary requirement has been in the past is you can only exchange PHI to the extent it is minimally necessary. But now, to go a bit beyond that, you may exchange PHI for this care coordination. And really, there's also, I almost skipped the third bullet point, but there's also a proposal to permit disclosures of PHI to home and community-based service providers, social service agencies. So this is just including more than just, provider A and provider B can exchange PHI, but all these other, maybe tertiary care operations can also exchange PHI, and it's all permitted as long as it's done according to these proposed rules. And I just wanted to note that these proposed rules really signifies the final shift from the old system of care, where it was more monetarily driven, to the new system of care with these value-based and care coordination ideals, which ultimately exist to improve patient care. And so even though it's still proposed and it's up in the air, it's really a great indicator of the way that these laws are beginning to shift the tides, so to speak.
And then in follow-up, another area that we're seeing some changes with the proposed rules is the notice of privacy practices. I'm sure all our physician practices are very familiar with this, and it's something that you probably have everyone fill out with their intake paperwork, and it's super easy. Except when all of a sudden we've transitioned to lots of telehealth.
Yes.
So because of that, when you need to get that notice of privacy practices, it's probably going to be a little more challenging, especially with some of the rules. Previously it was, or I guess it's currently a good faith effort, you need to take to obtain an acknowledgement that you essentially gave this information to the patient, and you need to document those efforts. And if you want to get an electronic acknowledgement from the patient, they have to consent to it, and it has to be, automatic and contemporaneous with the request for service. So how do you do that if you have someone call up and try to make a telehealth appointment, that type of situation? So now that they're moving to this new proposed rule where they're going to eliminate the requirement of the signed acknowledgement from the patient with respect to, receiving this document. And then, also they must grant the individual the right to discuss it with, a person designated by the covered entity. They want patients to be informed. And then, there's also some content revisions, including some information about what needs to be in the header of that notice of privacy practice document.
And so one of the last proposed rules that we've seen is we have these new requirements for a threat to health or safety disclosure, or just a general disclosure by a physician. So the threat to health and safety disclosures historically have only been permitted in dire or serious and imminent situations. So this proposed standard would change that to be permitted for just serious and reasonably foreseeable situations. And this grants providers more time to potentially intervene before a threat to health or safety becomes incredibly imminent and moments away from happening. So this once again goes back to patient care. They want it to be significantly improved. And then the next proposal is to revise the professional judgment standard to the good faith belief standard for other certain permissive disclosures. And so this is really important because professional judgment has always been a great standard, but by including the good faith belief qualifier, you have a presumption of good faith when doing these permissive disclosures. Of course, it can be overcome and rebutted with evidence of bad faith, but it just gives the provider that extra cushion of protection when making that disclosure.